Well, folks, we're continuing to talk about the monumental move on Capitol Hill Thursday. In a 5-4 vote, the U.S. Supreme Court upheld the Affordable Care Act. But now what? What does the ruling mean for you, the American people? Joining me now to dissect this decision a little further, USC law professor Jacqueline Fox. Thank you so much for coming in this morning.
Thanks for having me. Good morning.
Now, we've heard a lot of the political sides of all of this move, but bottom line, what does this mean for the average American out there sitting, whether they have insurance right now or not?
Well, the decision by the Supreme Court doesn't mean a whole lot for anybody. If they had found against health care reform, that would mean some things in the future. The biggest part of the decision that's going to have a potential effect on people in South Carolina is that the court said that the Medicaid expansion that was going to be part of that, it's up to the governor, basically, to decide if we're going to take the federal money or not to expand Medicaid. And that could have an enormous effect on the working poor in South Carolina.
Talk about that effect. If South Carolina and the governor decides to opt in to this expansion portion of this law, what could we be facing?
Well, it's pretty cool, actually. I mean, what you've got is, Medicaid right now is really based on wealth. It's how you've heard of spend downs, when older people have to sell their house so they can go into a nursing home. This changes it to be based on income. And it also says that it's not just for single mothers and children, it's for people whose income is less than 133% of the federal poverty level. And what it means, in effect, for people is that they now have access to health insurance. And that's a lot of people in South Carolina.
Yeah, definitely here and nationally. I know it affects about 32 million people. And just looking at some of the pros and cons now, children will not be denied coverage if they have pre-existing conditions. Children will be able to stay on their parents' insurance longer until they're 26. So there are some pros to this. Any cons that you see to this act passing?
I think whenever you have change of a big scale, when you're trying to figure out the best approach to handle broken situation, and honestly right now the cost of health care is a broken situation in this country. I don't think anyone can say it's not. You're going to have flaws because we're not perfect and we're trying something new. So to me it's opportunity more than I just don't know enough to point and say that's going to work and that's not going to work. And to be honest, I've been doing this for 20 years, and if I don't know, I'm not saying I know everything, but I don't know. It's the fear of the unknown. There's going to be stress on access. We're going to have to get better at figuring out the level of care people need. Like, not everybody needs to see a surgeon right away. You might need a physician's assistant, or there's something called a dental therapist who can work better on children's teeth than having to see the dentist right away, for a cleaning or something. So we're going to have to be imaginative. In terms of what goes on with Medicaid, by the way, I wanted to bring something up that if you are in a small business, for example, right, or if you're an individual and needs to get access to health insurance, and for some reason you haven't been able to at this point because you have a pre-existing condition or you just don't have the money, right, what's going to happen is there's going to be an exchange, like a website you go to. You put in your social security number, they're going to figure out your income, right, and then you're entitled to a federal subsidy. Almost everybody in this state is. That's going to help offset your premium costs, and that includes if you're an employee of a small business. So people, I think, aren't getting the full picture about how we're meant to interact with this system. Not everyone's going to have to go on Medicaid, for example, and I just wanted to say a specific number.
Definitely, because we've heard about that. There may be a surge in premiums, so talk about that a little bit.
So I don't know if there's going to be a surge in premiums or not. There may be initially. You have to remember, these are private, for-profit corporations deciding what our premiums are with some limitations. So who knows what the market's going to do. But if you have a family income of $25,000 for a family of 3, the most you're going to have to pay, whatever that premium is, the most you're going to have to pay for it is 3% of your income annually. And that's not a lot of money compared to what an insurance policy right now costs for 3
without
people.
This in place.
And if you're up to 400% of the federal poverty level, which right now is almost $74,000, the most you're going to have to pay of your income is 9.5%. Now that may sound like a lot of money, but if you look at what your insurance actually costs, not just your co-payments that you do with your work, but the actual full package,